Yes,
The
sir.
10-person rule, upstate law enforcement and upstate politicians have said it's either impossible to enforce, or we refuse to enforce it. How do you react? How do you enforce the 10-person rule? Also, congratulations on the International Emmy. Your reaction to that as well, please.
Thank you. Let me write this down because those are two different things. Yes. That's the underlying point of this discussion. You have this is an emotional time, political time. Everybody has their own strongly held opinion, right? You have a strongly held opinion that says COVID is all an overreaction, it's a hoax, I'm not wearing a mask, I'm not following these rules. You have sheriffs upstate who have said, I'm not going to enforce the law. Now, how a law enforcement officer says, I choose not to enforce that law, I believe that law enforcement officer violates his or her constitutional duty. I don't consider them a law enforcement officer, because you don't have the right to pick laws that you think you will enforce, and you don't enforce laws that you don't agree with, right? That's not a law enforcement officer. That's a dictator. So you're not a law enforcement officer. You can't pick and choose. And if that's the way you run your law enforcement agency, I don't consider it a law enforcement agency. So God bless you, but don't ask me for help. And I think it's a dangerous precedent. Police officer says, well, I don't think cocaine should be illegal, so I'm not going to enforce the cocaine laws. It's not up to you. You don't have that right. But it's signifying, because the upstate sheriffs, what they're doing is they're being political. The no more than 10 rule, people find intrusive. You're telling me in my house I can't have more than 10 people? It's none of your business what I do in my home. Now, of course it is. Laws apply in your home. Domestic violence applies in your home. Drug laws apply in your home. Yes, it does. Well, I'm going to celebrate Thanksgiving the way I always celebrate Thanksgiving, right? People on Staten Island. We're having the same big family Thanksgiving that we always have. And nobody's going to tell me not to have a big family Thanksgiving. I'm telling you that you are responsible for your actions. And here are the numbers, and the numbers don't lie, and this is the increase before any other increase from Thanksgiving. And if you increase social activity, then you're going to see the number go further up. I said to one person, I had a conversation with somebody on Staten Island, who said, I'm not following these rules, they're all baloney. I said, I'll make you a deal. I will exempt you from all the rules. You agree, if you or anyone in your family gets sick, you're purely responsible. He said, what do you mean? I said, if you get sick, or your family gets sick, you're responsible. You stay at home and get better. If you have to go into the hospital, you pay the bill. You find a nurse to take care of you. You find an ambulance driver who wants to drive a COVID-positive person to the hospital. You're responsible. Well, no. I'm not doing that. I said, oh, see, so you want to be able to act irresponsibly, but then endanger the ambulance driver, and endanger the nurse, and endanger the doctor, and endanger the 1199 member who has to come and change your bedding because of your actions. It's not like your actions only affect you, right? you act irresponsibly, you get sick. Now, 30 people are affected because you are infected, right? But there is no doubt that is an undercurrent, and it's in the numbers. The numbers are reflecting the behavior. You look at the areas where the sheriffs say, I'm not going to enforce it. You look at their infection rates, some of the highest infection rates in the country, in the state. You look at the communities in Staten Island that say, I don't believe this is true. They have the highest infection rates in the city. Was that a coincidence? Yeah. On the Emmy, when I first heard, I was flattered by it, but then I looked into it a little bit. Oprah Winfrey won it. Steven Spielberg won it. Al Gore won it for Inconvenient Truth, which I thought was just masterful. It is flattering, but it's also symbolic. I just watched it before we came down. For it to be personalized to me, I want to make sure people understand that I'm just the symbol of a much larger effort. The people who are around this table, who Rob, Melissa, Gareth, who were there every day, every public employee who was out there putting the numbers together every day, and really the people of the state who made it work, right? What they were saying on the presentation was, I gave facts. They never mentioned my sense of humor, by the way, nor did they mention any charisma or good looks or charm. They didn't mention a lot of things, but they said I gave facts. But it's that New Yorkers responded, and New Yorkers did respond. And that's how you go from a 50% infection rate to a 1% infection rate. And now you're at a 3% infection rate. And by the way, the parts of the country that didn't have it in the spring, they're now at 50% infection rate. Wyoming, North Dakota, and we're one of the lowest. It was really one of the most beautiful, effective exercises of social action, right? We did this first in the nation, first state in the nation to have a mask mandate. We're like 99% compliance with masks. Why? Because I made it a law? No. Could never ticket. You know, I think we gave out 10 tickets. New York City, all they use is sheriffs now. It's not that we give tickets if you don't wear a mask. It was just social action, social behavior. People accepted it. That's what the Emmy's all about. It was beautiful to see what people can do at their best, how they can come together and how they can sacrifice and how good they can be, especially in New York. All the diversity, black, brown, gay, straight, LGBTQ, all this diversity. It's a problem everywhere else. Differences, differences, differences. No, commonality, commonality, commonality. That's what New York said. That's what won the Emmy. So congratulations to New Yorkers, which I've always said, because it's New Yorkers who did it. Let's take one more.
Governor, the head of what measures
I will do more than one more, I'm sorry.
Can you talk about what measures the state may be taking in the of belt tightening in the event that a federal stimulus comes out that doesn't include aid for states and cities, and could that even include maybe even job cuts in the public sector?
If the federal government does not provide relief, state and local aid, belt tightening, it would be going from a 42 to a 29, okay, to stick with your analogy. I don't really know the relevance of that, but it sounds good. 44 to a 29 waste. You would have to do tax increases, government cuts, and borrow, and layoffs, and you would still have a long-term issue. You'd have to do all of the above. Let's say the number's about 50 billion. Go to the highest income tax in the United States of America. How much do you think it makes us? $1.5 billion, 2 billion tops. Highest income tax in America. We're second highest now. We'd go higher than California. 2 billion tops. Okay. Now you need another 48 billion. So you'd have to do all of the above.
To put it another way, just how vital is that stimulus?
Oxygen. It's oxygen. I had all the governors on the phone. I'm chairman of the National Governors Association. It's every state. And also, there's a broader point. One of the governors said, he was exactly right. We were briefing Joe Biden. If as goes the states, goes the nation. You can't say to 50 states, go bankrupt, without saying to the nation, go bankrupt. It's a problem for every state. If they don't fund the states, I think you'll see a national recession. And do you really want me to lay off essential workers? You know who the essential workers are? They're the teachers, the police, the healthcare workers who are supposed to be doing this new vaccine process, which is going to be an operational nightmare.
Governor, speaking of the vaccine, Operation Warp Speed, the head of it said that a vaccine could be ready as soon as December 11th for distribution. What is the status of state efforts? And has any thought been given to this idea of prioritizing vaccinations for people who are most at risk of spreading the virus compared to purely based on medical vulnerabilities?
The prioritizations are done by medical personnel. You raise an interesting point. I don't know how you would determine. Well, you probably are hitting the same class. If you're doing healthcare workers and essential workers, you're doing people who are coming in contact with the largest number of people, right? Essential workers are coming in contact with the people, with the public.
The current plan would just prioritize the frontline workers, not necessarily an essential worker at Starbucks or something who might see lots of people, right?
Well, it depends on what, you know, the first plan, the outline of the plan, the big question is how much product, how quickly, you know. Are you going to be getting 1 million doses a month? Are you getting 500,000 doses per month? And when you know the supply, you can come up with the actual plan, specifics of the plan. But right now, the first priorities are people who are senior citizens, people who are immune compromised, and that's going to be the first tranche. Rob, do you have anything newer on that or different?
No, I think the numbers are, it really is going to depend on how much vaccine we actually get and then prioritizing. So we're building categories of people, right, based in those categories. But as the governor said, it's going to come down to how much vaccine we get and when.
Pharmacies have been a big...
held two in-person fundraisers over the weekend. Do you think mayoral candidates should be doing in-person fundraisers as COVID spikes? And what examples do you think mayoral candidates should be setting right now?
I think they should be setting the highest standards, and they certainly shouldn't be breaking the law, right? So the law is the threshold, and I don't know what anybody did or didn't do, but if it violated the law, one of the sheriffs should go give somebody a ticket, and I think, if anything, they should be setting a higher bar.
Pretty much anywhere you go in the city today, you see long, long lines of testing sites. CityMD is very popular because people like those 15-minute tests, and they have those now. But there are other sites as well, and there are long lines pretty much anywhere you look. Are there enough testing sites in the New York City area? Should there be more? And is one test enough to go celebrate Thanksgiving?
Yeah. Just so you know, we do more tests than any state in the United States. We have we do more testing pro rata than any state in the United States. And we have more testing sites pro rata than any state in the United States. In New York City, you have 420 testing sites. 420. People shop sites, and as you pointed out, certain people like one shop better than the other shop, or CityMD versus this one. But we have many of the 420 have no waiting lines at all. Now, they're not the shop that you want to go to, then it's your choice. You can either wait on a line or go to one of the places that doesn't have a line.
Do you want to share any memories of Polly Trottenberg's time on the MTA board now that she's leaving her job as DOT commissioner?
No, I don't have any special memories.
So the state Senate Democrats seem to have a supermajority. So how is that going to change the power balance between you and the legislature, since they have the power to override any of your vetoes, like, you know, raising taxes on the super wealthy?
Well, two things. The way the state government really works is through the budget. All the main things are done in the budget. And supermajority or not, it doesn't really make a difference. And I can't think of a situation where every Democrat in the Senate, you know, the senators are individuals. They're not really a monolith or sheep. So I don't think there's ever been a situation where I disagreed with every Senate Democrat. And you have to remember, Senate Democrats, it's just not just that they're not sheep. They represent different parts of the state. You have senators from Buffalo. You have senators from Long Island. And those are the places that I represent also, right? So, what was your point? You want to make that point? Yeah, why
No,
don't you
I
make
was
it?
just going to say, and I think that this is a little bit much ado about nothing. We fought to elect these candidates. The governor endorsed up and down. We fundraised for them. We've got personal relationships with many of them, and we were thrilled when a bunch of the members that looked like on election night they weren't going to make it have now pulled through. So this is great news.
Yeah, I supported them all and worked very hard to elect them.
Governor, you mentioned construction workers showed up during this pandemic. Do you consider teachers to be essential workers? And do you feel as though they've lived up to that during this pandemic? I mean, it does seem like every union, MTA workers, nurses, police officers, all did show up in person, but the ones who didn't really were the teachers.
Well, the teachers did show up as required by the government, right? The MTA, we said we're going to keep operating the MTA, and this is how we're going to do it, and the MTA workers showed up. Construction projects, it was very important to me that New York pause didn't mean we stop building, we stop improving, and they showed up as required by government. The teachers showed up as required by government, right? They fulfilled in New York City what the mayor said they had to fulfill. So it's not the teachers who decided whether or not they were coming. They fulfilled their governmental obligation. Do you have another point?
No, and I would also just add that for the teachers, a lot of them had to go above and beyond and figure out how to do distance learning and remote learning. Many of them were upset not to be in the classrooms. We know that that was their preference. And so I think that they were just as essential and showed up the same, if not more, than others.
Please think about thinking about Thanksgiving differently this year, because it has to be a different Thanksgiving. We can't have, you look at that current rate of increase. You're going to 6,000 cases in 3 weeks. you can't have an accelerant on that number. You really have to reduce that number. This is not a normal Thanksgiving. It's a better than normal Thanksgiving. It's a deeper Thanksgiving. It's a more meaningful Thanksgiving. Mariah loves me so much, she's not coming to celebrate Thanksgiving with me. That's how much she loves me. We have to get our head there. Thank you, guys.